The success and the value of any procedure that you offer in clinic is directed by the wants, the needs, the desires of the modern patient. To quote Jim Morrison from The Doors in one of his hit songs, "We want the world and we want it now." The modern patient is looking for procedures which are affordable. The modern patient dictates that they want procedures which are fast, procedures which are comfortable, procedures which don't deliver extensive downtime. But you'll also notice, particularly on social media, that the modern patient has a very short attention span. They look for variety, they look for inspiration, and something that keeps them entertained. You can do all of this with your DP4. Your treatment time is just 3 to 4 minutes. Likewise, because of the intensive vibration, top speed is 120 revolutions per second to now facilitate an unprecedented 1,920 puncture channels per second into the skin. This allows for a vibrational therapy that will dissipate nerve receptors, allowing for you to treat even without use of a topical local anesthetic. There is no heat and there is no ablation with your DP4 device. And as such, your standard patient should experience just 24 to 36 hours of a mild to a moderate sunburn in both experience and sensation. You should never see bruising. You should never see grazing. You should never see track marks, nor should there be any flaking or shedding of the skin following the procedure. So in fact, we see a downtime of just 24 to 36 hours. Your DP4 is a facilitator, which will also enhance the infusion of active substances and agents into the skin. And serving as part of combination therapies, you now have an exciting procedure that you can update, that you can customize, and truly tailor for every patient, every indication, every session, every program, every time. Your DP4 as a skin needling device arguably is a pioneer in what we call regenerative medicine. Probably the first form of regenerative medicine is the traditional Chinese medicine practice of acupuncture, with some 2,500 years worth of experience. Via the insertion of a needle, it affects the flow of qi or the flow of energy. However, the microneedling story began in the mid-1990s. And regenerative medicine refers to a category or group of procedures which work with your own body's healing, repair, and regenerative cascade. Why this becomes important for the modern patient, but why this becomes important for the modern aesthetic market. I view this as the fundamental for every procedure that you treat. It is a non-negotiable. There's a lot of misinformation with how patients understand how procedures work physically within the skin. For example, botulinum toxin. I've been moving my hand for a very, very long period of time. I stop moving my hand, you can see all the signs and lines of dynamic and movement and static lines. However, if I inject 48 units of botulinum toxin, I'm going to prevent muscular contraction. Despite the fact that I can no longer move my hand, the reality is that if you look close enough, it has no effect on texture, tone, quality, health, integrity of the skin. We also understand that you can put as much filler as you want into the skin. But again, if you don't treat and target the quality of the skin, all you have is bad skin that's dense, bad skin that's revolumized. So your DP4's value as part of a regenerative medicine procedure physically treats and targets the health, the appearance, the quality, the functionality, the integrity of the skin. And this now becomes the fundamental procedure as a standalone, but to also support all other procedures that you perform in clinic. This opens up a big variety of demographic. On one hand, you will have the naturalist. The naturalist is the patient who doesn't want what they perceive as chemical intervention. They don't want injectable intervention. They want a procedure that works with them to make them look as best as possible. to maximize their skin's potential. This is a DP4 procedure with DP Dermaceuticals. On the other hand, you'll also come across the high-tech patient. They want anything and everything that you can possibly deliver to them. And of course, your DP4 serves as the ultimate facilitator for infusion of drugs, infusion of mesotherapy actives, and as part of combination therapies, but also your key fundamental procedure for skin health and quality. Your DP4 as a skin needling procedure has a very simple philosophy. I want you to think back to childhood. You're riding a bike. It's a summer's day. The wind is through your hair. The sun is out. Nothing could go wrong until you fall off your bike. You graze your knee. On that micro-trauma goes a sticking plaster. Some 3 to 4 days later, you remove that sticking plaster, and the area which was damaged, which had undergone a micro-trauma, is now whiter, pinker, softer, smoother, better texture, better tone. So in fact, visually, an even better quality than what the surrounding tissue is. So we understand with a simplistic approach, or what I call backyard science, that human skin has the capability to reset, to remodel, to rebuild, to repair, and to regenerate itself to an even better condition than what it was before. You just require the right facilitator. Your DP4, as an automated microneedling device, delivers up to an unprecedented 1,920 puncture channels per second into the skin. The epidermis remains intact. As such, your DP4 is a summer procedure. Your DP4 is a winter, is a spring, is an autumn procedure. But with treatment time as little as just 3 to 4 minutes in clinic and patient recovery, a mild to a moderate sunburn in appearance and sensation for just 24 to 36 hours, your DP4 is also a lunchtime procedure. And in conjunction with a camouflage sunscreen post-operative product, its application ensures that the patient can go right back out into public without showing any signs of having undergone a procedure. More importantly, the versatility of your DP4 opens up new opportunity to treat and target 100% of ethnicities and 100% of Fitzpatrick skin types. The reasons why: there is absolutely no heat in your DP4 device. So by removing heat, this removes the risk of post-inflammatory hyperpigmentation. To further create safety, predictable, and reliable outcomes, your combination therapy, particularly with the DP Dermaceuticals MG collection, now becomes a treatment non-negotiable. By comparison to the old-fashioned dermal needling rollers, but also subcision or dermal stamps, your needles enter cleanly at a 90-degree angle and exit cleanly at a 90-degree angle. Because of this, your needles are significantly smaller, 33 gauge. But likewise, it means that by comparison to a roller, where some 75% of your revolution are the needles cutting and arcing through the skin, there is no ablation with your DP4 procedure. And as such, the epidermis remains intact. This is why it's a summer procedure. This is why it's a lunchtime procedure, but also for those patients who are prone to the release of profibrotic growth factors or your precursors to scar tissue, you can safely treat all skins, all ethnicities, all Fitzpatrick skin types.